Hi, my name is Rich Iorio. I'm the Chief of Adult Reconstruction and Total Joint Replacement at Brigham and Women's Hospital. I'm also the Vice Chairman of Clinical Effectiveness. As of April 1st, I'm the President of the American Association of Hip and Knee Surgeons. You are listening to Interview with the Surgeon with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Richard Iorio, Chief of Adult Reconstruction and the current President of the American Association of Hip and Knee Surgeons. Doc, how are we doing today?
Very good, Matt. Thanks for having me.
Thank you for being with us. So, getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
So it's interesting. I came from, a fairly middle-class background. My dad was a school teacher. I was lucky I went to Harvard University as a college, and I had some interaction with orthopedic surgeons during my college summers, and decided that, I really wanted to go to medical school, and I really wanted to concentrate on orthopedic surgery. Joint replacement appealed to me early on. I was fortunate enough to get into medical school, and then I did my residency at Hahnemann down in Philadelphia, which was later known as Drexel, which has since gone the way of the dinosaur. But, again, fairly, blue collar roots. But then I did my fellowship at Columbia in adult reconstruction with Nas Eftekar, who was a surgeon and had roots in John Charnley's total hip replacement experience. And I went out and tried to find a job, but I went to medical school with a Massachusetts state contract grant, which essentially paid a state tuition worth of money toward my tuition at BU Medical School, which was one of the most expensive medical schools in the country. I came out with a lot of debt back then. In the early and mid 80s, the interest rates were 18 and 20%. So I had a big debt burden. So taking that grant really helped me getting into school and to get through it. But part of that grant process was I would have had to pay all of that back fully if I didn't practice in Massachusetts, because they're having difficulty getting surgeons to come back to Massachusetts. So at that point, I interviewed for all three facets of practice. I looked at a private practice opportunity with a very, very well-accomplished man who I had known since I was a kid. I looked at academic opportunities around Boston. And then I settled on Leahy Clinic, which was a multi-specialty group practice. And in the early 90s, when I came out of my fellowship, that was when Hillary and Bill Clinton were entering the White House. And there was a lot of talk about managed care and limiting cost. And so I kind of felt that pretty much the reorganization of healthcare, which has happened already under Obama and some of which has gone on recently, would have already happened back then. It never really did anywhere else in the country except Massachusetts, where there's almost universal coverage. And whether you're in private practice, academics, whatever, you get paid pretty much the same. But the beauty of a multi-specialty group practice was that I didn't have to worry about building a practice. They were Dr. Leahy's patients. And we could operate on the things we felt comfortable with. And we had mentors and a group experience that was very cool, and that we all kind of grew up together. There was 5 or 6 of us that came in at the same time, and Leahy Clinic grew. So academics isn't for everybody. Private practice isn't for everybody. We hear the term privatedemics now when we hear candidates interviewing. That to me is a bit of a cop-out. I mean, either you want to teach and do some research, or you want to just do your practice. And don't be disingenuous and fail to tell the people you're going to work for what you want to do. There's plenty of room in orthopedics for all of that. And even in our fellowship, which is one of the more competitive in the country, we look at candidates and we want both. We don't want just 4 academic guys that are never going to operate on anybody. And we certainly don't want to end up recruiting 4 people that only want to do surgery. So there's plenty of room for all of that. So be honest with yourself academics isn't for everybody, but there are plenty of jobs out there to get what you want rather than be unhappy.
Now, what would you say were some of the keys to your success that shaped your early career as you climbed the ranks of your profession?
Without a doubt, mentorship is the key. I think I was fortunate. I came home to do my practice, so I had referral systems in place. But you need senior partners that are willing to help you improve and foster your career and your personal development. You know, how to build a practice. I mean, the classic line is, it takes a really long time to build a good reputation in a community, especially as a surgeon. It takes a very short time to get a bad reputation. So learning what mistakes to make and not to make and how to do it, technology adoption and being a fast follower versus a quick adopter. What's the best way to introduce change into a practice? Those are very important parts of how you'll be perceived later on. And you can be the guy on the billboard doing the latest thing and charging the most money. That may not be the best strategy for long-term survival if you want to stay someplace for a long time. So be careful. Pick your friends. Pick your enemies even wiser. But do what's best for your patients, and generally you're going to end up doing just fine.
Can you briefly just take us through your journey and how you became the chief of adult recon over at Brigham and Women's Hospital?
Yeah, so at Leahy Clinic, I climbed the ranks. I actually was hired to do general orthopedics because they had enough joint replacement guys. And I started out doing a lot of trauma and some joints. I did some foot and ankle. I think I'm the only person in the country that's been in the Hip Society, the Knee Society, and the Foot and Ankle Society. And I don't tell anybody that. It's too late for anyone to take up on that now. So eventually I became the chief of adult reconstruction at Leahy Clinic. Leahy Clinic went through some changes. The group practice changed. They had some financial problems, and they weren't going to be as academic as they had been. So I opted to look for other opportunities. I could have gone to Dartmouth, Penn, UMass. I ended up down at NYU with Joe Zuckerman, who is a real leader in orthopedics, a legend, one of the Mount Rushmore kind of guys. Bill Healy was my mentor at Leahy Clinic. I stayed. I would probably still be at NYU, but my family wasn't happy down there. So we came back to Boston, and I'm at the Brigham now. And my partner and chairman, Jim Kang, is terrific as well. So I've been very fortunate. I pretty much had the same job at Leahy, NYU, and the Brigham. But at NYU, I had 45 guys doing joint replacement underneath me. And not just, I say guys, I mean surgeons. We had pretty diverse faculty. And, it's just working in an orthopedic specialty hospital is a different animal. Very exciting, very fast paced. And New York is a different reimbursement paradigm. So it was fun. And now I'm back in Boston, and, the wheels spin a little slower up here. But working in one of the greatest hospital systems in the world is fascinating, and it's fun, and I'm home. So you've got to balance that work-life balance. My wife hates the term happy wife, happy life, but it's very true. Very true.
So as a chief of the program, what advice do you have for the graduating chief presidents and fellows entering the professional job market for the first time?
Yeah, I don't envy you right now. The job market is tough. The pandemic has made things difficult. Hospital finances have never been in worse shape. The government in Washington isn't exactly helping us. But having said that, being an orthopedic surgeon is a wonderful profession. It always will be. You may not be the richest person on the block, but you will be one of the most fulfilled if you do it the right way. So, number one, listen, we're like tennis players, right? we play on the same court no matter where we are. And you can make that grass greener if you cooperate and do what your partners and your institutions expect you to do. And if you're not happy, there's other places to go. But you got to make sure you're in a place where your family's happy and they can be fulfilled. You want to make sure the practice style is appropriate. Listen, 50% of our field end up changing jobs within the first 5 years. So plenty of people make mistakes, or it doesn't turn out to be what they wanted initially, but that's okay. You can change. And don't be afraid to change if you don't like it. But adding to that, give it a few years. Everything's difficult the first few years. It takes 2 or 3 years to build an appropriate practice. Don't shortchange yourself. You'll change a little bit too as you mature. And don't expect everything to be handed to you. There is a little bit of a ladder here. You'll get more given to you as you earn it within a practice, as long as your partners are fair people.
Now, as we're dealing with the pandemic in 2020, still now in 2021, a lot of these national conferences have really gone online. What advice do you have for the graduating class regarding their networking and outreaching process in a virtual world?
Very difficult, right? I mean, this is true in any business right now. There's very little opportunity to interact with your compatriots in the office and to get real mentorship. Having said that, even when you get to where you're going to work, there's going to be limited opportunity. We do a lot of Zoom meetings here, and I don't think we've had a group meeting in person since the pandemic started. So it's doable. It's not ideal. But my advice is to reach out and communicate. Don't hide. Don't think it's going to happen just because you're thinking it should happen. Reach out, email, Zoom, phone calls, overly communicate rather than under communicate to make sure things get done. Everybody's remote. Admins and secretaries may drop the ball. The person you expect to hear from may never have heard from you. A lot of these chiefs don't even answer their own email. So, reach out, maybe get a cell phone number. Don't assume anything in this environment. We're all in parts unknown right now. And the other thing that's starting to affect, especially our job market up here, are the diversity initiatives. And there's all sorts of new rules for interviewing candidates and the breadth of exposure. That has slowed everything down. Decisions are not made in the blink of an eye. I am not allowed to hire somebody by myself anymore. I need somebody else on a committee. We need to make sure it's a diverse committee. We need to make sure we've interviewed diverse candidates. And in orthopedic surgery, the field is not as diverse as it should be. So it really slows down what we're doing. So just keep that in mind. In the end, it'll work out. And yes, there's fewer job opportunities, but there's still more jobs than there are candidates. So we just have to spread it out a little bit better.
Being a program leader, what are you looking for when interviewing medical students for resident spots and also residents for fellowship spots?
Yeah, we're extremely lucky, right? I mean, this is Harvard Medical School, so we get the best of the best. I actually look for some real world skills. We don't have any trouble getting smart people. We don't have any trouble getting a diverse residency. We don't have any trouble getting people with good grades. What I need is people with some sense who can actually function as a surgeon within a hospital environment and with their fellow residents and attendings in a real world sort of way. Let's face it, we're all on the spectrum somewhere in this field, but I need people who can communicate, pass on information, and interact in a team format. So that to me is the most important. I'm assuming the other stuff is going to take care of itself, or you wouldn't be applying here. For fellows, where we get you for a year, it's like adopting a fresh air kid for a year. You want to be able to have a good personal interaction with that fellow. You want to make sure they have good hands because you end up depending on them a lot. But like I said before, we take mixed gold fellows because we want private practice people, we want academic people, we want intermediate people, researchers and non-researchers. So if you have a talent and your residency program speaks well of you, and we're fortunate. We get we take 4 a year. We don't usually go below 15 or anything like that. So we could throw darts at the names and come up with a good group of people.
So as the current role as a president of the American Association of Hip and Knee Surgeons, what initiatives are you excited about? And also what resources are you providing to the next generation of surgeons?
So we have a three-legged stool sort of format, right? We do a lot of advocacy. So we're down in DC and with the AMA and the RUC, and we're fighting for your reimbursement and for your relationship with the hospitals and trying to provide some context to maintain your ability to make a living. So that's number one. Number two, we provide excellent educational content. We provide the premier arthroplasty educational event of the year at the annual meeting in Dallas. And within that annual meeting, there's a resident course. We provide fellow education throughout the year with virtual meetings at the focal program. We provide candidate member services for fellows who want to join before their attendings. We support the match process through the San Francisco Match for adult reconstruction. So once they become fellows or apply to become fellows, residents are basically entering the AAHKS realm. There's 5,000 total joint surgeons in AAHKS now, and those are all the surgeons that do 50 or more a year. So our new initiatives are, we've started a diversity board. We completely understand that, for the longest time, we were a bunch of old white guys. We have a women's and arthroplasty initiative. We have a young arthroplasty surgeon initiative. So we're trying. We need to recruit more and different people. We need to promote those more and different people into leadership roles and in the committee structure. And we're doing that. It'll take some time, but I'm pretty excited about the direction we're going. We have some young, very talented people helping us do that. Having said that, the reimbursement side of things and the move toward hospital employment is it's getting to be a sticky wicket. All these hospitals are going to have difficulty with the move toward outpatient surgery. The inpatient only rule is going away for arthroplasty and will go away completely in orthopedics next year. That is going to put the pressure on us as a profession to provide value to hospitals. We have been very valuable entities to them because we generate a lot of revenue. We are now going to start generating less revenue. How we put that package together and keep our value to those healthcare institutions alive and positive is a challenge. We've saved a lot of money for the system over the past few years, and we haven't been rewarded for that. We've cooperated in value-based care. We've cooperated in the bundles. We've saved CMS a boatload of money, and we've been assassinated in the RUC and through the reimbursement process. So we're going to look at alternatives and see what we can do to combat that, and we do that for our members. So I think anyone that's interested in arthroplasty should certainly join, and we'd be glad to get their help and to use their services to help us achieve our goals. Again, I'm really worried about these guys coming out with enormous debt and what they're going to do. But they know it. There are a number of 2 doc families coming out, and they'll figure it out. But it's a real worry. I'm glad they are passionate about it. There's been more applications this year than ever. I just hope there's enough jobs for them. That's all.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.